Hi everybody, welcome to UnravelingRare. So I'm Richard Novak, I'm the co-founder and CEO.
And I'm Frederic Vigneault, I'm the CSO and co-founder.
And we're here at IRSF's Research Symposium, Science Conference, as well as the Ascend Summit, which is the patient-centered part of the conference. And we're presenting 3 posters and 2 talks, one for the families and one for the researchers, on our clinical trials in Colombia with vorinostat.
Yeah, it's been pretty busy, well received, a lot of questions, a lot of people coming to us. So it's been, I think it's pretty much been the best IRSF meeting we've had. Yeah,
I agree.
yeah.
Super collaborative.
Yeah.
People are really excited. There's a lot of good things going on in
Yes.
Rett, right? And whether the 2 gene therapy trials, there's UCB with fenfluramine, there's Acadia, and a lot of advances with trofinetide. A lot of other drugs in the works.
Yeah, even some newer companies or older companies are presenting Rett data now for a change instead of like their platform or whatever. And even like some of the scientific PI or that are most academic now are like asking questions about the upcoming treatments. So yeah, this is new. I really like that.
Yeah, no, it's just really fantastic collaboration discussions with clinicians. I mean, one in Charité in Berlin, here Gillette, many people, of course, in the Twin Cities.
Yeah.
I think it's it looks like a very different conference now, very translational, impact focused, very exciting.
It is. I mean, just now we're at lunchtime and we're seeing like a bunch of clinicians talking with the patient. They're basically kind of doing office hours. We're doing this, and it's the first time also we see like sort of an exhibit for patients and families. A lot of resources. Yeah, it's completely different.
Yeah, my favorite part of that was the sort of wheelbarrow attachment for hiking. It was really amazing, and they tried it out with the family. We put a patient in the back, a little girl, and then the mom was strapped into the harness, and they were walking around. It's really amazing for someone who loves hiking. Out there, like this is pretty awesome that people are thinking about that.
Yeah.
And so what's your biggest highlight?
Yeah, because this is really like the first Rett conference was like the 20th anniversary of the discovery of MECP2 as a gene that caused Rett syndrome, and at that time we had Ionis who was basically saying we're shelving. They were not saying that, but basically what they were saying is like we're shelving our ASO treatment, and Novartis was basically saying like we're shelving our gene therapy program, and so nothing was like going well basically in terms of treatments. Like trofinetide had like some phase 2 paper that we used for our own head-to-head comparison, but nobody was sure was going to go anywhere. And now, like we mentioned, like there's I don't know, like 7 clinical trials going on, 2 gene therapy, a bunch of small molecules. There's a couple ASO coming around, new treatment. I mean, the pipeline list of things that are coming is pretty big. Like even in our case, like they're listing Unravel 1 as a phase 1/2, and the Unravel 2 is on the list now, right? So I think that's the biggest change for me. Like looking back, like at 5-6 years ago to now, it's just like people have been are living on hope, and it's like hope is right around the corner. I mean, they can get treatment like trofinetide, and even Acadia is like trying to make change to the formulation so people can stay on it. And
basically 3 years ago they got approved, and it was the first approval, right?
Yes.
So that, which is huge, but it wasn't as great as everybody had hoped, and so now they've optimized it, and it's really impressive.
Yeah, I was just talking with their sales team, and like everybody was taking it and then getting off of it. So they really work hard to try to get something that patient can take. And we've had the parents sharing their experience. Some are taking trofinetide, some are not, because those that are not, everybody's trying it basically. And it seems to be like half and half now. Who's saying like, they think it works. But at least like they can stay on it, and the other one is just they cannot stay on it. So
I mean, patients need options, right? That's key.
But there's options coming, which is neat. What about you?
Yeah, for me, I mean, I think it's this recognition that there is no average Rett patient. I think it's becoming more and more recognized, especially as the gene therapy studies are rolling out. All the patients are not the same at all. Some have much better benefits than others. A patient is not a mouse. And even within the mouse models, there's some studies that I think Minorik showed some of the results in their work, where in the mouse models, there's a bimodal distribution. You have higher responders and lower responders to a therapy. That's every drug ever. And it's about time that it's getting recognized. I mean, we've been doing this starting with individual patients from the start, but it's been hard to kind of break through that idea outside of clinicians who see the patients, but on the research side that, a mouse isn't representative of every patient of a disorder. And if you just look here, I mean, what's so meaningful to me is the Ascend part of the conference, actually meeting the families that are here and seeing the patients, interacting with them. They're not all the same, not even close. Whole range of capabilities, from walking, talking, to wheelchair bound, not very interactive. And that's all the same diagnosis. For all we know, it might be the same mutation.
I mean, one of the mother who share experience, like she has the two daughters, right? One is wheelchair bound. The other one walks and run everywhere and face plant, like we saw it a couple of times. They have the exact same mutation.
Yeah,
right?
And they're totally different.
Yeah.
Yeah. Or, I mean, what was exciting, Huda Zogby's talk on mice, and if you train them continuously from very early on in development to just right like at the very end, kind of intensive but late-term training, with completely different outcomes in terms of performance, physical performance, but also molecular mechanisms. And this is treatment as with just a training intervention. There's no pharmacological change, and yet it has this vast implication on transcriptome, is what she showed. That's amazing, but it just goes to show that, like, even how much physical therapy a patient has, or even these non-interventional environmental factors, it matters. And everybody's different, and therefore it makes them a different state of a patient. Also shows that each patient is very plastic in a good way. You can shift from these different states, and there's, as a result, there's a lot more opportunity, a lot more hope.
It does sound that the communication is still the big thing that people want to, and I mean, some of the one of the gene therapy that showed like improvement, like in at least one of the girl on communication. And I mean, to your point, like about patient being different, like we're eating outside, and like one of the girl in the wheelchair, like she was basically like she can say mama, right? Like so the mom like left and it was like mama. And other kids, like you can't tell, like you're never gonna
completely nonverbal. And others are talking a lot more than that, right?
But still, like so, but for those that are nonverbal, like that's what we hear. Like parents would like to know what they want. So that's tough to assess in a mice model or anything like that.
The other part of it, it's a really great thing that I always look forward to at these conferences is it's such a small world and big one at the same time. And so whether we run into the same researchers we interact with, maybe you've never met in person until now, that work on all these other disorders. We work on 110 different disorders. We see a lot of other clinicians and other researchers, and have an opportunity to meet them here. Or like the mother that we just talked to, where she lives one town over from where I live, and we meet here in Minnesota, right? And so it's sort of a large world and small at the same time, and it just goes to show that these disorders collectively impact everybody that you know to some extent. You're basically one step removed from a patient of some sort, maybe not Rett, but maybe something else. And it just shows the importance of working in this space, but also the potential. It is not a small number of patients that need help, and it's an opportunity as well as a need that we need to address. Good. One last thing. What's your funniest moment from this conference?
I mean, at the conference itself, I don't know. We did take a ride with a very creative Uber driver, so that was interesting. The guy's pretty smart though. Like, was asking what we're doing here and so on. And he was able to follow pretty well. He has like an interesting use of Gemini, basically, to create very funky songs about his life experience as a Uber driver. So it was interesting.
And he has a tailored one for everybody, it seems.
Yes, it does.
So this was Uber meets the medical world.
Yes.
It was hilarious. 30 minutes of really hilarious AI generated content. All right. Well, I think that's it for this episode. It's been really great. Any last impressions?
No, that's good. I mean, we still have like meeting schedules, so it's going well. So
all right.
Hopefully we're gonna have more news later.
And we keep updating on the clinical trials. We have first 2 patients dosed, first 2 Rett syndrome patients dosed, 4 Pitt-Hopkins patients dosed as of today. Couple mild adverse effects. Most of them aren't even thought to be tied to the drug dosing. No serious adverse effects. So it's looking quite promising in terms of enrollment. That's looking fantastic. So we're just really grateful for all the collaboration and support from the families that we work with. More updates soon.